Pre-operative instructions. Preparation for rhinoplasty. Avoid painkillers such as aspirin, ibuprofen, Advil or Motrin, naproxen, Aleve, vitamin E, ginseng, herbal supplements, and any medications containing the aforementioned compounds for 2 weeks before the operation. Acetaminophen, paracetamol, is the only painkiller that can be used. Avoid consumption of green tea herbal teas. Black tea and coffee are allowed. It is preferable to minimize your alcohol and cigarette consumption for 2 weeks before the operation to allow your body to adapt to general anesthesia and comfortably wake up thereafter. Do not drink alcohol for 1 day before the operation. Patients with thyroid disease or high blood pressure should continue their regular medications. If you have a runny nose, sore throat or flu, please inform us. Avoid excessive sun exposure for 2 weeks before the operation. Avoid consuming vegetables and fruits, particularly red foods such as tomato, pepper, strawberry and cherry that contain salicylic acid, which is the active ingredient of aspirin. Our team will provide all medications that you will need after the operation. Our nurses will explain how to use the drugs, including antibiotics, painkillers, local dressing, creams and sprays on the day of discharge. Avoid nasal procedures such as intranasal epilation, hair removal and deep peeling for 2 weeks before the operation. Day of operation. A. Things to consider when coming to the hospital on the operation day. Do not eat or drink, including water, for 6 hours before surgery. Fasting for 6 hours is essential for a safe operation. Bring your passport for check-in to the hospital. Do not wear makeup or removable accessories such as jewelry, nail polish, piercings, contact lenses and hair clips on the operation day. You may wear glasses but not contact lenses on the operation day. On the day of the operation, you will be most comfortable in a tracksuit with a zipper. Slippers, a toothbrush and toothpaste will be provided by the hospital, so please do not bring your own. B. Procedure after hospitalization. Our team will supervise the hospitalization process approximately 2 hours before your operation. After hospitalization, you will be taken to your room. In your hotel room, lock your valuables in the safe or give them to your relatives. The scheduled operation time may be changed by the hospital and will be determined 1 day before the operation. The operation may be delayed if the previous operation takes longer than expected. Such situations occur rarely and are outside our control. The service nurse will ensure vascular access, help you change into the boxer's apron that you will wear in the operating room, and obtain your consent for the operation. Almost 30 minutes before your operation, our operating nurses and Professor Dr. Seckin Ulusoy will visit you in your room before you are transferred to the operating room on a stretcher. When you arrive at the operating room, electrodes will be attached to your chest and fingertips. Then you will be asked to breathe into a mask, which will make you fall asleep. After your operation, our anesthesia team will monitor you in the recovery room of the operating room for an average of 45 minutes. When you are fully recovered, the team will shift you back to your hospital room. At night and on the next morning, all of the drugs that you need will be administered by the service nurse through the vascular access. You will not require any drugs from outside the hospital. Your edema will improve if you apply the ice cubes provided by the service nurse below your eyes at night for 15 minutes per hour. Please apply the ice cubes for 48 hours after the operation and, if possible, on the day and night of your discharge. You can drink water and eat food 1 and 2 hours after the operation respectively. Please inform the service nurse before you stand for the first time after the operation and when you need to use the toilet. Please do not attempt to stand up unassisted because dizziness may occur for 1 to 2 hours after general anesthesia. C. Procedure in Istanbul after hospital discharge. Our team will discharge you from the hospital on the day after the operation. You will then be free to return to your hotel. We will follow up with you in our clinic on days 2 and 6 after the operation. During the first control visit, your recovery will be evaluated. The second control visit will be 1 day before your return flight. In general, we remove the splints from the inside and back of your nose during the second and final control visits. We apply a second plaster before you return to your country. After you remove the second plaster in the shower 6 days later, your nose will be completely open and you will be able to perform the massage that we teach you. Our surgical nurses will perform your post-operative follow-up evaluation. If you have any questions or require assistance, you can reach our nurses at any time on +905 306 031 492.